One of the issues, too, in helping address this is the fact that we do not have enough test kits. We know that many individuals, as my fellow member to the right of me, Mr. Raskin, pointed out, there are individuals who have requested test kits and have not been able to access them. My understanding is as late as last Saturday, ground zero in King County, Washington, that the healthcare professionals from that facility still did not have access to test kits. Mr. Redfield, do you know if that is true or not?
We have provided test kits to the health department. The University of Washington has developed their own tests.
Were those test kits available last Friday?
Yes, sir.
Thank you. And without test kits, is it possible that those that have been susceptible to influenza might have been miscategorized as to what they actually had, that it's quite possible that they actually had COVID-19?
The standard practice is the first thing you do is test for influenza. So if they had influenza, they would be positive for
But only if they were tested. So if they weren't tested, we don't know what they had.
Correct.
Okay. And if somebody dies from influenza, are we doing post-mortem testing to see whether it was influenza or whether it was COVID-19?
There is a surveillance system of death from pneumonia that the CDC has. It's not in every city, every state, every hospital.
So we could have people in the United States dying for what appears to be influenza when, in fact, it could be the coronavirus or COVID-19.
Some cases have been actually diagnosed that way in the United States to date.
Thank you. I want to turn a little bit to the CDC website, because I appreciate the information that you're putting out, and it's so important to the American public, but I also want to make sure that they fully understand it. On the CDC website is published a guide called, quote, Framework for Mitigation, Actions for Protecting Communities from COVID-19. In that graph, it provides 3 levels of transmission, none. In other words, you're in a community where there is no reports of any cases whatsoever. The second area is minimal to moderate, and the third is substantial. Dr. Redfield, how many cases of coronavirus are considered to be, quote, minimal to moderate?
Right now, when we see basically transmission cases, particularly if they're non-linked, we're looking at cases in the 25 to 50 range to see that groups begin to move into the moderate range, sir.
Okay, thank you. That's helpful. I would suggest that the CDC put that on their website so that the average American can read it and understand exactly the precautions they should take. So then substantial, I would assume, then, is when you have 50 cases or more in your community, you can consider it substantial?
Yes, sir.
Okay, thank you.